let's talk about trichomoniasis. So this is basically a sexually transmitted disease caused by a single-celled protozoan, that's a Trichomonas vaginalis, and is primarily an infection of the urogenital tract. The most common site of infection being the urethra and the vagina. Trichomoniasis has occasionally been identified in the upper genital tract of women with PID, that's pelvic inflammatory disease, may be isolated from the urinary bladder. For the clinical presentation, um, usually in women, it causes vulvovaginitis accompanied by persistent vaginal discharge, and the discharge is profuse, frothy, greenish, or yellowish, and at times foul smelling. The pH of the vagina usually exceeds 5.0, and urinary symptoms also may occur. In rare cases, there may be low abdominal pain. In many cases of bacterial vaginosis, trichomoniasis may develop as well, and the other way around too. So in many cases of bacterial vaginosis, it also develops as well too. The examination shows a yellow or green vaginal discharge or inflammation, sometimes extending out into the vulva and adjacent skin. Punctates hemorrhages can occur on the cervix, giving appearance of strawberry cervix. So the diagnosis, usually by microscopy. So microscopy of the vaginal secretions mixed with saline shows numerous polymorphonuclear cells and the motor organism identified from its shape and four moving flagellae. The trichomonates are a little larger than leukocytes, and it is a screening test and not for diagnosis, and it has low sensitivity of about 50 to 70%. Culture, preferably in Feinberg Whittington medium, is required, and the gold standard is NA80. So as you can see from this slide, these are just few points to note. The infection is with vaginalis, Trichomonas vaginalis, and is associated with a twofold increase of cervical neoplasia, and it has been associated with preterm labor and also preterm delivery. Trichomonasis also increase the risk of acquiring HIV. The treatment, normally we use these antibiotics, metronidazole, tinidazole. Metronidazole 2 grams as a single dose or 500 milligrams BD for 7 days, and tinidazole 2 grams single dose. Normally, sexual partners of patients should be treated before resuming intercourse, and a test of cure is recommended 3 months after the treatment.